Welcome to this edition of Doctor and Patient Conversation. In these conversations, we try to address important questions that we all have on common health issues. I'm So Mittal from the Patient for Patient Safety Foundation. Today's topic is on lung-related issues. In India, both young and old are increasingly facing a wide range of lung disorders. It is very important for us to know what are these disorders, why do they happen, why are these orders, and when do they come in? What are the consequences? How can we identify as patients, treat them, and prevent them from becoming serious? And very often we ignore them and they become very serious later on. We are very fortunate that today with us, we have Dr. Humayun Kabir. He is a very qualified, experienced, and well-known pulmonologist, and who would be sharing today his perspectives and also give his advice on the questions that we just raised. Welcome, Dr. Kabir, and thank you very much for accepting to share your views with all of us, particularly for us as patients and caregivers on this very important topic. To start, Dr. Kabir.
Thank you, Mr. Mittal, for having me here, actually, giving me the opportunity to share that knowledge into everyone, actually. So let's start.
Yeah, it's a pleasure. So, you know what, I think it'll be good for our audience to hear about your overview on lungs, its functions, and the kind of common disorders that happen and its consequences.
Yeah. So, as you know, there are very vital organs of the bodies. There are a few very vital organs of the body. Lung is one of them. The lungs' main function is that to inhale oxygen, to inhale the oxygen and to expel the toxic carbon dioxide, which is produced during our metabolism or in our day-to-day life, to expel this thing throughout our body. So lung is a filtering organ. So basically it's a filtering organ. So filtering organ, that intake of oxygen and production and the carbon dioxide to be exhaled. This is the primary part. So breathing makes you to air to inhale, but lung, within that air we inhale, their lung rectify the oxygen and carbon dioxide and do it the way that is needed for the body, actually. So apart from this breathing part, apart from this oxygenation part of the body, lung has various other metabolic functions also. So for my thing, but my this is a very common thing that you can tell me that first of our life starts with crying, that is expansion of the lung, and last breath we take before we die. So lung is the organ which is introduced to the human body in the external environment first and last. So it's a very vital organ of our body, and the thing is that because it's exposed to air very frequently, because the breathing is one thing that you cannot eat for one day, you cannot drink for 6 to 8 hours. The breathing is inevitable. It's a autonomous process that chip has been introduced to our brain. So brain is functioning and we are breathing, but we are not not aware that we are breathing. We are breathing for 15 to 16 times per minutes, but taking 400 ml to 500 ml air per breathing. But that is not, we are conscious about it. That is the beauty of the lung, actually. That is the beauty of the breathing. But the thing is that that is not in our control also. So sometime, whenever there is this awareness of the false awareness of the breathing, that we have to take our breath, that we are getting fatigued, we are having a heavy breathing, we are having a chest discomfort, we are having cough, we are having fever, chest pain, and cough. This is the most three common symptom, that is the most of the presentation of a pulmonary disease. And the thing is that is most likely that the disease comes from environment, because we are lung is directly exposed to air. So there is, and lung is there is the unfiltered air is coming throughout through the lungs. So depending upon our immunity, depending upon our air quality, depending upon the bacteria of in our body, outside, whomever we came contact with, the consequences happens. So maybe there are several parts of the lungs that can get affected, actually. So in my simple description, I can say that when we take the air to the lungs, there are some blood supply vessels. There is a blood vessel supplying the lungs that take oxygen from the air, and that carbon dioxide that is produced from our body during metabolism, that expels through the blood vessel through some mechanism, that we, whenever we exhale, that carbon dioxide get out, and whenever we inhale, the oxygenation part occurs. So this is the main, and this is the simple thing we can say ki anything, any problem in our lungs actually, that will affect our breathing, that will affect our general condition also. Apart from having a pneumonia, having a COPD, having a asthma, having a bronchitis, there are different spectrum of the disease that can affect our lungs actually. So this is whatever you have asked the question, that is a very vast topic actually, so I cannot concentrate to a very few paragraphs. So whatever I am telling you, ki this most common symptom whenever we facing a lung problem that occurs is cough and breathing trouble and fever and chest pain. These are the major complaint of the that lung disease that we have actually. So that we'll discuss later on, as the question will be more specific. I can answer that will be very much
No, no,
specific actually. So
no, I think very good. I think you've stated it very well that our life starts with breathing and lung is a part, and our life ends with it. So it's a very important area, and I think that's why we chose this subject. So we have very commonly this some of these things that you mentioned, cough and a breathing issue, etc. How do I know that this is time to seek medical help and guidance? Because sometimes we just sit at home and we think it'll get better. When do we
hmm.
come and meet somebody like you or go and meet our physician, because it's going to get serious? So are there conditions that you would suggest to us that we should look out for?
That is a very good thing you have asked, because the thing is that lung has an enormous capacity. So in depending our activity level, our breathing requirements actually varies. Actually, that young athletes who runs every day, it require lots of amounts of air. And when the people do a sedentary works like office work, they consume very little bit of oxygen per day actually. So whenever they come to a stress level, suppose one person who is doing a very sedentary life work, but whenever he starts walking and he starts running, for some reason he said he is not able to control his breath, he is not getting either some amount of air. So that is the point, he has to get aware that something is bad is happening to our body. Maybe may not be, because the breathing self awareness of breathing and feeling of fatigue and feeling of breathlessness is a mixture of everything. It can occurs from lung, it can occurs from heart, even your blood pressure level is low, even your hemoglobin is low. That is also you can have a breathlessness. But thing is that whenever you are having symptoms, when you are getting some activity, that is the first thing you should notice. Key. Whenever I am doing some activity, whenever I am doing some activity, and I am feeling not I am not able to do it. Suppose stay suppose walking up three stairs, walking up the third floor, walking, and this is the usual for our young and 40, 45 years, 50 years old, 50 years old population. That is okay, but I am not able to do it. And the thing is that whenever having a chronic cough, not like that cough, the cough is a actually protective reflex. Okay, anything bad in inhale through our lungs, the lung will try to cough it out, because our body is adapted to it actually to do that cough reflex. But when the frequency is very bad, that is affecting your day-to-day life, because there is no numeric key how many times cough that before we should have to attend a doctor. That is not like what that does not work like that way actually. Whenever you are when you are coughing, whenever you are coughing and whenever you are coughing and feeling that there is something that frequency of cough is affecting my day-to-day life, and cough is a symptom, not a disease actually. So anything that is from pneumonia, even for bronchitis, even for asthma, even for allergy, even for dyspepsia and acidity, you will have cough. So any abnormal sensation of breathing, I am not getting adequate amount of air, I am having too much cough that is disturbing my day-to-day life. I am having a chest pain. I am having coughing out of blood. That is the 3 to 4 most common scenario. That is that is the point when you should consult a doctor. And one thing I want to add up to this thing actually, because our lung has the enormous capacity to adjust till our lung function deteriorates less than 50%. That at that time patient will be symptomatic. That is a very bad thing. That is a very good thing also. So the thing is that whenever we people see that is going to smoke and this is कि डॉक्टर साहब मुझे कुछ नहीं हुआ अभी तक, I am fine till now. But the thing is that the lung function is deteriorating, and it will come at one stage that when he is going to get symptomatic, already something bad has been happened. So before that, I'm telling you, you do your daily exercise, you do your daily course, and you think that I am not able to do that thing, then when you have to go attend a doctor actually. And apart from that, we all common know the symptoms of chest pain and hemoptysis, coughing out the blood. That is a very serious symptom actually.
But so you mentioned many things. So for a common man, we hear these terms saying asthma, bronchitis, COPD.
Yes.
So if you take these ones, for example, can you help us say what is the difference between these? Because symptoms are similar, right? Breathlessness and so on. And is there a different way to diagnose there? Is the treatments different? So if you can cover these 3 areas, asthma, bronchitis, and COPD, very briefly, sir, it will be
very briefly. I will try actually. Actually, see that asthma is a type of allergic disease. Allergy means that is anything in we inhale or we eat, that is and body it reacts to it abnormally. That is called allergy. So allergy may happen in while we're taking any gastrointestinal tract, our digestive system also. And we usually know some, if we are allergic to something, when we eat it, that there will be something itching in our body. So that same thing happens to airways also. So asthma is type of airway allergy. So asthma is a type of airway allergy, that is some of our air particles, some of our infectious particle, that is whenever this enters the lung acts abruptly and abnormally, and reducing this lung capacity and having this symptomatic cough. So cough will be there, and patient will be noisy breathing, wheezing will be there. And most importantly, this is seasonal and this is episodic. Patient will not be symptomatic throughout the year in asthma. So asthma, there will be some seasonal symptoms, and there will be some exposure to some noxious particle, noxious air quality and bad air quality, that will lead to patient become asthmatic and patient become symptomatic. So asthma can happen in a very healthy from since childhood, and there may be a family history. Maybe mother or father may be affected for asthma, and then patient having skin allergy also, and patient may particularly find out there will be episodic in nature, but may be happening in winter season, maybe happening in rainy season, and patient may have to have a cat allergy, may have a dog allergy, and whenever they comes now nearly to this type of noxious things, and the patient gets symptomatic, having allergic attack, having asthmatic attack, and having the choking, there will be chest tightness, and it will happen since childhood also. So it can happen in childhood, and on that side, in other side, the chronic bronchitis, what you are saying, and that COPD, what you are saying. Actually, the COPD is a spectrum of the disease that includes chronic bronchitis also. So chronic bronchitis and emphysema, this is going to be medical discussion. I'll not elaborate it, but one thing is that COPD, that chronic bronchitis comes out under spectrum of COPD. COPD is, and the other side is the permanent damage of the lung due to continuous exposure of noxious stimulus like tobacco smoke, like air pollution, like smoke from the car and factory, and whatever this is, that carbon monoxide and all the thing that goes and irreversibly damage our lung epithelium, normal membrane of the normal lining of our lung parenchyma or internal airways of the lung, and that's why lung cannot function normally. So airway is becoming narrowed. So and the thing is that whenever airway get narrowed, the breathing will be difficult. So we have to work more to get a that certain amount of air, and inhale, exhale, both will be difficult. So that will be shown to affect our day-to-day life. We cannot exercise, we cannot do our daily course, and this will happen. This will progress day-to-day life. And when the if the exposure of this noxious particles like smoke is going on, like continuous smoking, the disease will progress. Ultimately, it will go to in a very bad shape, and the thing is that key patient will be dyspneic and he will need more medications. So bronchitis, chronic bronchitis emphysema most likely occurs in the older age group after a certain age group of certain duration of that noxious particle exposure that will require to damage the lung airway, and that effect shows later on. And apart from asthma, this is a different thing. This is allergic disease, and it's episodic. So I hope I made it some
No, no, I
amount
think
of
it's very good. So
clarification.
allergy can happen anytime. It is episodical. It is because of certain stimuli, and COPD and bronchitis builds over time. So that's very
Please
clear.
over time.
Are the
Okay.
what are the how do you diagnose these, and how do you what kind are the treatments very different?
No, actually, this is very important to diagnose, which is asthma, which is COPD, and this because the treatment is very different actually. So the for diagnosis purpose, most of the respiratory patient we need to go to a specialist, not go to a general physician firstly, most likely, because most chest physician is not the first person to comes in a day-to-day life actually, because cough is a very common symptom. So most people go to the general physician. So physician, whatever they try to find out what are the maybe the common cause of cough actually. Maybe the common cold is the most common cause of cough. So apart it will go in 7 to 10 days or something like that. But whenever it's episodic, it's getting continuous and it's affecting his day-to-day life. Say, so we do a chest X-ray. The first investigation. Why? Whenever we have long-standing cough or baseless, we do a chest X-ray. So chest X-ray can identify the any nature of the disease, and also we do spirometry. This is a very wonderful test for assessing the lung function. To anything obstruction is going on inside the lung. So whatever we do, we forcefully expel our air like this and do the test actually. So there are many advancement, many types of lung function tests are there. So there is a diffusion of carbon monoxide, DLCO, there has been impulse oscillometry is there. So depending upon the age, depending upon the patient's choices, so we can modify, we can change, and we can order this investigation. It's a very experts actually scenario to order this investigation. So beautifully this test finds out which is asthma, which is COPD, and the treatment varies actually. So most of the important thing, if you are not covering the treatment part, I'm getting it a bit a hint visual, because most of the people are afraid of getting treated by inhaled medication. They think it's a very bad thing. It should not be there, should not be given to all. But most this is the basic concept is that because your lungs is affected, I am giving the medicine directly to the lungs. So whenever we are getting tablets or injection, it will circulate throughout the body. So it can have an adverse effect to the other organ, effect to the lungs. So whenever we are giving inhaler medication, so the thing is that so the only the disease part of the body is getting that medicine. So it's very specific thing. So inhaler is good.
So
So inhaler
inhaler,
is good.
nebulizers, all of them are directly to the lung.
All of them directly works in the lungs, so it's a very good thing. You should whenever your doctor's advises to use an inhaler, please do use your inhaler. There
That is
should not be any hesitations.
so. Doc, is there anything that we can do to prevent these kind of asthma or COPD?
Ah, okay. So I can see that asthma is in the rise actually, because of the air quality are getting down, and people are on the processed food, because there is a beautiful hypothesis was there once, that's called hygiene hypothesis. Whenever we are when we in childhood, whenever we are in infants toddler actually, we should have to play with more dust soils to get it allergic to it actually. So we do the opposite, we avoid it. And the thing is that, and our air quality is getting down, and cesarean deliveries are increasing, and we are usually used to having processed food. So we are not adapt. Our body is getting new challenges day to day lives. So that is why we are having these types of autoimmune, as may say, autoimmune disease, that is immunological phenomenon. So it's actually happening over the decades, and the scenario is rising. So I think, so if you have any healthy lifestyle, like do not do not forbid your child to play outside. uh, do not and ensure any, do not get any artificial foods, and do an and the thing is that the list is very vast. Actually, we are gone beyond, what can I say, the starting from using that chemical pesticide to our vegetables, and having the refined oil. So we are having gotten bit far, actually. So that's why this is one of the lifestyle disease that's been happening. So it's very less in the native populations, but in rise in, when very much rise in urban population. So I don't know if asthma, how can we prevent? That is no clear cut. I cannot see anything. But COPD, and because asthma, what is it? It's a genetically, it's a genetically designed disease. So who will be going to asthmatic and who will not? I cannot define. But the thing, beautiful thing is that when we know that these things and this situation getting me attack, getting me symptomatic, when I go there in the winter season, when I take intake this, when I inhale there, when I in workplace, when I many people in India, they are earning livelihood in a very bad environmental, bad factory condition. So the thing is that I cannot, I want to say more, but the time is limited. But whenever I work in a Durgapur, a very industrial area, there is a too much colliery, steel plant area. People are working in very bad environment, in very
Understood.
bad air quality. That the thing is that continuous exposure of these things, that can be prevented by, and I don't know, maybe humanitarian ground, maybe something, work safety
Yeah, better
rules.
factory conditions, exhausts, and so
Yes,
on.
yes,
So,
better living
yes,
condition, and so and so and so and
yeah.
on.
So
So that can also.
moving in from asthma and COPD, we often hear so many cases of pneumonia, right? And
Yes, sir.
pneumonia, we hear also about fatalities that happen in hospitals due to pneumonia. Would you say a few
Yes,
things about pneumonia? And also, today, doctors are prescribing vaccination to prevent pneumonia. Could you just
yes, yes,
cover
yes.
very briefly on pneumonia and this aspect, and how can we work on pneumonia, and same issues on how.
Pneumonia is a simple bacterial infection of the lung tissue. As we can simply elaborate by it. Pneumonia may be viral origin, maybe bacterial origin, maybe other fungal also. So depending upon the patient's background, that can affect heavily, hit hard, or maybe just a casual cough and cold that can go away. So in most of the it gets serious when the patient is diabetic, old age, obese, and having that comorbid conditions like kidney disease, and the patients having already have a pre-existing asthma, pre-existing COPD. So pneumonia you should not ignore. So pneumonia, it's a very bad. It always it's always concerning for the population of at risk, old age, diabetic, kidney disease, comorbidity. This is the main thing. And the thing is that okay, whenever you have having a cough and cold and you become lethargic, and see that maybe the symptoms are not there. You were saying this is maybe something that I am not. This is maybe cough and cold common. It will go away. But if it is not getting better within 3 to 5 days, within 2 to 4 days, actually, so please consult a doctor, because nowadays that whenever our community acquired pneumonia is getting very serious within 2 to 4 days, we are having more ICU admissions because of this pneumonia, and the thing is that the pneumonia has a very high mortality when it's come presented at a very untreated or late stage. It is getting it get complicated whenever you, and the thing is the scenario is getting very bad nowadays, because after COVID the things of pneumonia and things of respiratory infection is in the rise, and lung immunity is somewhat become low, actually, because the thing is that pneumonia you can prevent, but pneumonia, I am a very I'm getting it very straight. We are preventing one or two types of bacteria to getting it pneumonia, because it's very common. We are giving pneumococcal vaccination, that is available. So pneumococcal vaccine that prevents that pneumonia from streptococcus pneumoniae. That's kind of organism that is a thing. So there are several other types of bacteria also that can cause, but this is the most common pneumonia that we are that we are facing. So please do get vaccinated if you are at risk. If you are having, you are a smoker, if you are alcoholic, if you're immunocompromised by any means, like you are having a job in a very dust and shady environment, and also we are giving a influenza vaccination for the prevention of viral influenza. So viral influenza, it's a very viral disease because it's most likely self-limiting. But the thing is that after a viral infection, it's get a secondary bacterial infection. It's becoming serious. So we can prevent by getting an annual influenza vaccination also. So there is available annual
Last
influenza
question.
vaccination.
Thank you. This is very encouraging that, we must, whoever is susceptible to that risk, we should get.
Yes, yes.
So, Doctor, just last question, a message to the smokers. It's never too late to stop smoking. Do you think a smoker's life can be reversed? Can it get better?
The thing is that logically, scientifically, there are people thinks that smoking some 10s or less cigarettes will affect nothing. This is the most common question that has been asked. But the thing is that whatever you do to whatever you smokes, whatever amount you smoke, that is going to getting affect the lungs in any much amount in depending on the dose of smoking. Basically, this is a very straight cut thing that I can say. You are getting a heavy smoker, you will get disease early, your lungs will be very bad, become very bad earlier. So after 40, 45, naturally our lung function declines in a usual rate. So that decline, so nature has defined as our lifeline in such a beautiful way. So it will go down, down, down. It will be able to maintain your daily life course in such a way lung function will sustain. But if you are a smoker, the lung function will decline very rapidly after a certain age, and that's why you will get symptomatic very earlier, and you will have COPD. And the thing is that it's not getting symptom because your quality of life will be very bad, because whenever the COPD is there after smoking, you will feel dyspneic in 3 to 4 steps, and you cannot do your day-to-day life.
So, uh,
You will
so
survive,
basically,
but your quality of life will be very bad. So
so
I
Doctor,
am warning you.
what I'm hearing you saying, it's never too late to stop smoking,
Yes.
right?
Oh,
Because the deterioration can small. Doctor, I must thank you for this
I
wonderful.
I am very much in threatening way, because I am not in very compromising in this smoking scenario, because and always if you quit, even if you quit before suppose you have a surgery yesterday, you are a smoker. So if you quit if you quit 3 to 4 smokes in before surgery, it will do better. It will have your better oxygenation in your blood. So what is always, it's always to quit smoke. It is always in to have encouragement in your body. If you are a smoker, please do not smoke and quit as soon as possible. And if you want help, there are several ways of quitting smoking. There are several drugs are also available there. And it's not like it will not get better, because it will get better eventually. So trust in yourself.
Thank you
You
so
can
much.
do.
Doctor, this has been wonderful. Your insights have been very, very useful. I'm quite sure that our audiences are much better informed about lung diseases. There are lots of takeaways that you have given, and I'm sure that all of us will be more cautious now and ensure that this very vital organ that you spoke about, right, we keep it healthy and have a longer life. So,
Yes, yes.
as you heard from our expert, that with a little care and being aware, you can actually keep good health and safe health. We will continue to bring to our audiences such informative conversations with specialists so that we continue to have safe health. As we always keep saying, our health is our responsibility. And thank you, Doc, again for your insights.
Thank you, thank you, thank you, thank you, thank you for having the opportunity. Okay,
Thank you so much.
you.
These doctor-patient conversations are brought to you by CAHO and Patients for Patient Safety Foundation. CAHO is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by CAHO, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.